Hello, everyone. My name is Karen Hess, and I'm the Interim Vice President of Transplant at Baylor St. Luke's Medical Center in Houston, Texas. It is truly my honor to welcome you all here today to this St. Luke's patient reunion. We are thrilled to host a special celebration to honor our staff and, most importantly, our patient, Mark Svatek. You know, our hospital staff works tirelessly every day to turn unbelievable stories into reality. And seeing all of you here today truly validates our efforts. Now, our real passion over and above is actually to send our patients home to be with their families and loved ones. And it takes a truly special team, amazing communication, and the right resources to achieve that goal. And as you're going to hear today, innovative technology like the Breethe OXY-1 system has allowed our teams to achieve major successes, such as that of Mark Svatek. This reunion allows us to complete the full circle of care and provides our team members who played a critical role in Mark's care an opportunity to reconnect with him. And I would like for everyone to join me in recognizing Mark and his outstanding St. Luke's care team. So now it's truly my honor to turn this talk over to Dr. Gabriel Lohr, who is our incredible surgical director of the Lung Transplantation Center at Baylor St. Luke's.
Thank you, Karen, so much. It's obviously an honor and a privilege here to be able to talk a little bit about a case that's very special to us. Every case is special to us here at Baylor St. Luke's. We transplant patients from all sorts of different types of illnesses from different geographies around the country, some more acute than others, and people have been dealing with end-stage lung and heart disease for a variety of different times in their lives. Mark's case, I think, highlights a lot of what we do well here. And there's several points that attest to that. So number one, there's the multidisciplinary collaboration. And I think you'll get that feel for that right now. That multidisciplinary collaboration was critical for diagnosing what he had, for determining the best path to treat him, and then also for taking care of him postoperatively. And that multidisciplinary care is a definite strength of what we offer at Baylor St. Luke's. Number two, another thing that we do a lot of, we have a strong history with, is innovation. And so we're really thankful to always be involved in a variety of different clinical trials, whether we're testing different perfusion devices or we're testing different systems used to help oxygenate or to help support the heart in patients that are dealing with end-stage lung disease. So there's collaboration, there's innovation, and then there's surgical experience. That we were gifted to have a lot of excellent surgeons that were involved. I'm the surgical director, but in fact, my partner, Dr. Shafi, who's out right now, but he has a great breadth of experience and helped to do his operation, which helped us to get him through. And finally, and perhaps the most important, is the day-to-day ICU care of him postoperatively, which you're going to hear our intensivists talk about, and the critical care nurses that stand by his side. Of course, Mr. Svatek himself is an extremely motivated individual, and you'll hear from him. And that's very important when we take on a difficult case like his. It's important for the patient also and their family support to be strong advocates for themselves and to be able to get them towards the transplant listing process, and then also getting them strong afterwards. So I'm going to talk a little bit about the innovation side here. So Mr. Svatek was on an ECMO device because he underwent a complicated cardiac operation. I'm going to let his cardiologist talk more about the details of that. but he had a little bit of underlying lung disease that wasn't 100% clear before, but became more evident after the transplant, after his cardiac operation. And it became so severe that we couldn't oxygenate him with a breathing tube alone. And so he needed an ECMO device, which gives oxygen directly to the blood. And these devices are fairly invasive. They're very large tubes that go into the blood vessels. They're like huge IVs, and they can constrain a patient to be in bed and not be able to move around too much. So the clear benefit of the Breethe technology, where that's taking us, is in making these systems smaller so that a patient who needs this kind of invasive support can be up and ambulatory and moving around. So the Breethe device doesn't so much refer to the cannula that was put in. Those cannulas are called the Medtronic Crescents or the Avalon cannulas. They're small cannulas that go in the neck or in the subclavian vessel. But it refers to the system that oxygenates the blood. And those systems can be very, very big and very cumbersome to move around. The Abiomed Breethe one is one that actually is transported with like a suitcase. And as a matter of fact, it doesn't even need an oxygenator hooked up to it. It can actually condense room air, so that ideally the holy grail is that somebody may someday even be able to leave the hospital, walk outside, potentially even go home, like we have left ventricular assist devices now, total artificial devices. So Mark was a part of the early rollout of the device, and he was very successful with it. We were able to move him. He was ambulating, he was standing, he was working well with our physical therapy program, which should be heavily commended in this praise of his progress. And he showed us that technology is safe, it's viable, it's efficacious, and helps us to get a patient with a complex lung pathology towards a lung transplant. And then thankfully his lung transplant was performed in expert fashion, and he recovered very well from that, but it was a very high risk, high stakes situation. Very proud of our program for taking his case on, very proud of him and all of the people involved in his care. So with that, I'm going to turn it over to his cardiologist, to Dr. Postalian, who is a phenomenal partner with us, works out of the Texas Heart Institute, strong collaborator for many years, and I'm going to have him talk specifically about his care and the beginning of his journey and where he's at now.
Thank you, Dr. Laura, and hi, everybody. Again, I'm Alexander Postalian. I'm an interventional cardiologist here at St. Luke's, and I met Mr. Svatek when he first came, and I want to sort of go over his story that highlights his willpower and also the devotion of the team that took care of him. The first time I heard of his case, it was because he was being transferred from an outside facility because he had aortic valve regurgitation, and he had a history of a previous chest surgery to place a prosthetic aortic valve, and that valve was failing. In the initial call that I had, it seemed like the initial team wasn't 100% sure of how bad the problem was and thought it may not be so severe. But we here looked at the images, and it became evident that it was quite bad. And when once he came to our hospital, I went to the bedside and I saw him sitting on the side of the bed, just struggling to catch his breath. And some hemodynamic parameters like his blood pressure were very indicative that a big problem was going on. And that same night, we had to act emergently and place him on ECMO, extracorporeal oxygenation, which is the machine that Dr. Laura was mentioning, big cannulas to essentially take blood out of his body, oxygenate it and pump it back in and take the role of both his heart and his lungs. Once that was stabilized, then we were faced with the discussion of how to fix the valve. And that is a big discussion because you have two options, which is fixing it through the groin with a catheter or fixing it with open heart surgery. The problem with fixing it through the groin is that if the valve had an infection, the original valve, then this operation would not be successful and it could be catastrophic. And the problem with doing it with open heart surgery is that it was very high risk. especially because he already had chest surgery in the past. And we went back and forth. It was a big team involving many of our docs. And we had a suspicion, a significant suspicion that that an infection was going on, even though that wasn't entirely clear at the moment. So we decided to go with open surgery, which was done the next morning, a very, very complicated surgery. And fortunately, that was the right choice because the valve indeed looked like it had signs of infection. We placed a new valve, fixed his aorta as well, and left him on the circulation machine. And as Dr. Lore was saying, Mr. Svatek had lung disease from before that required oxygen therapy, but he was fine on oxygen at home. However, after the initial surgery, we could not seem to get oxygen in his blood. So we had to keep him. We switched the type of machine, but we kept him on extracorporeal oxygenation for just a bit over 3 months, which is pretty remarkable. And he ended up receiving a lung transplant, unplanned lung transplant, that same admission, which to me is also extremely remarkable. After that, his course was a little bit rocky, but he obviously improved. And last time I saw him, and I see him today, I mean, I am in awe of the amazing recovery that he made. The amount of time that he was on extracorporeal oxygenation was very significant, and the fact that he could perform physical therapy while he was on it, I think was critical to his recovery. And on a personal note to Mr. Svatek, and also the team that took care of him, I want to thank everyone, because honestly, it might sound a little bit cliched, but your case specifically is renewed the way I see patients, renewed, honestly, my faith in the profession. I see things differently. And I think as a consequence of my experience with you, I'm a better doctor today. So I really want to thank you and everybody.
My name is Mark Svatek, everybody I haven't met before. And I got a wife, Carla, who really stood by my side the whole time, and my stepdaughter and my kids, my 2 boys. Sorry if I get a little emotional, but anyway, like Dr. Stallion said, I went to Methodist first with this condition to get checked because I couldn't breathe without. I was at 6 liters on the breathing air already at home, and I couldn't get no more out of my bottles and stuff. So I knew I had to do something. So I went to the hospital, and they transferred me to St. Luke's because of my previous open heart surgery there before. And when I was after my heart surgery and my aneurysm repair, when I was sitting in recovery with the Breethe machine and the blood oxygenator and everything, I felt normal. I mean, it's hard to say, but I mean, I felt like I was a normal day sitting at home since I had all this equipment attached to me. And like he said, Dr. Stallion said, I was able to get up and walk the floors at the hospital with the help of the PT people, the nurses, and the other teams and everything. And it was beneficial because, I mean, it helped me restore my strength a little bit more before my open heart surgery, and was able to get it moving around and not just being in a sitting, non-performance kind of situation. And I appreciate the help of everybody, my doctors and the nurses. I can't thank them enough because that was truly remarkable what they did for me. And since I've been home, I've been able to get back to some of my normal routines. My breathing's getting a lot better. I continue to see my lung doctors, and I continue to get better every time I go to my appointments. They're real happy with my progress, and just continue to keep going that way. Be able to get back to some of the things I do around my house, doing some honeydews for my wife and all that, of course. And I mean, I'm really really feel good. I'm getting a lot better, and I appreciate the help of everybody in the breathing machine and everything else.
Hey, Mark, this is Alicia Heinrich. Sorry, I'm not at a computer that has a camera, so I can see you, but you can't see me. Anyway, I was one of the physical therapists who worked with you. It is such a joy to see your face, see you thriving, seeing you doing well. That's so rewarding for us, when we work with people, to see them out of the hospital and doing well. So it's so good to see you. You were such a hard worker, and I always tell people that's most of the battle. You were always determined. It was just so great to see you every day, because you always had a smile on your face and a determined spirit. Please tell your wife I said hi. And,
I will.
And just keep doing what you're doing. It's so good to see you at home.
Thank you. It's good to hear from you.
Hey, Mr. Svatek. I've taken care of you after your operation multiple times throughout, days and nights, and so is my group of intensivists who worked with you. And
Yes.
my extenders as well, my nurse practitioners and PAs. But as you've witnessed, this is so grateful. I'm so happy to see your journey through all of this. And it's remarkable. And I'm blessed to be part of your care, and you're blessed to be where you are right now. And
Yes.
the beautiful thing I've seen is the number of people involved in trying to get you there. Alicia just spoke. Our physical therapists were essential. Our technology was amazing, because it allowed you to walk through the hallways with the breathe machine. I think that was very consequential to how you were able to get your transplant, and the surgeons and the cardiologists and our nursing staff. I mean, it was just amazing to see your outcome. When you walked out of ACOOL, you rang the bell, right? That
Yes, sir.
you're leaving. Yeah, I remember that day. I was coming on to nights that day, but that the point of all this is just it's, as Dr. Postelian said before, for me itself was changing. It was a life-changing experience, because you see a person that I think other centers would say it's a lost cause, but then now they're walking out of the hospital, and in the same course of your stay, you got a lung transplantation as well. I mean, it was so remarkable, and so grateful for you and everyone else that took care of you. And we're going to continue to do what we can here at Baylor St. Luke's.
Yes, sir. Thank you for your help and everything.
All right.
And I truly admit it is a miracle. I mean, I praise God every day.
We will never forget you, Mr. Svatek.
I'll never forget y'all.
It's true.
On behalf of Abiomed and the entire Breethe team, we also thank you and Texas Heart for the partnership that we've been allowed to continue to grow through your experience and through, the ability to get up and walk and all of those things. We've learned so much through you and many others that have been supported on Breethe. So thank you not only for being there and the team here on this call as well. We really appreciate it. And patients in the future will be able to thrive and get their transplants as well because of your experience and the partnership we've had. So thank you all very much, and congratulations, Mark.
Thank you.
Hi, everyone. My name is Jamie. I'm the patient advocacy specialist at Abiomed. I just want to thank Mark for taking time to join and sharing his story. It means a lot to the Abiomed team and personally to see you face to face. So thank you for joining. And I also want to thank the whole team at Baylor St. Luke's Medical Center for helping us put together this reunion and reuniting Mark with his medical teams who took exceptional care of him. So thank you.
Thank you so much.
Thank you.
Mr. Svatek, we'll see you in your next visit.
All right. Thank you, Dr. Stallion.
Keep doing well, Mark.
All right. Thank y'all.
Thank you.
Thank you. Wonderful.
Thanks, Karen.
Bye.
Bye-bye.
Thanks.
Take care.